A thorough physical examination is essential before establishing a successful physical therapy regimen. A key element is the special physiotherapeutic examination besides the standard orthopedic and neurological examinations. We will now focus on specific physiotherapeutic elements. The therapist should examine the patient at a stance, at different gaits, and during specific movement activities. Weight bearing on the limbs. Often there is less weight placed on the lame limb at a stance. Flexion and extension of the joints. Weakness and trembling. Is the line of the back physiological or not, like kyphosis or scoliosis? Head position. A stiff head-neck position can, for example, hint to cervical disc lesions or the wobbler syndrome. And finally, body conformation. Muscle asymmetry can indicate muscle atrophy or swelling. Is the animal able to sit down, lay down, and rise to a stance? While sitting down or laying down, one pays attention to a smooth flexion of all involved joints. Pay close attention to the hind limbs while the animal gets back up. Does the animal have difficulty to place weight on the hind limbs? Is it difficult to transmit the weight to the front limbs? The gait is assessed while walking and trotting, while the patient is on a short leash, and while the animal is moving freely. The examiner should assess the gait on different types of terrain if possible. The patient should be observed from all sides, for example, from the front and the back, right and left. One should observe posture during gait. The line of the back. Does the back swing freely in motion? Is lateral flexion of the spinal column increased or reduced? Is there more lateral flexion to one side or the other? Can any peculiar head, neck, or pelvic movements be detected? How is the tail position? Lameness is evaluated according to the standard lameness classification schemes. In addition to assessing the severity of lameness and classifying the condition as supporting leg lameness, swinging limb lameness, or a mixed form of lameness, special attention should be paid to the following criteria. Joint flexion and extension during the stance and swing phases of the gait cycle. Stride length. Foot position during the weight-bearing phase, under the body, lateral. Dragging of the feet. Proprioceptive deficits. The patient should always be walked and trotted in large circles, but also in sharp turns if possible. The above lameness assessment criteria should also be evaluated during turns. Turns are helpful in uncovering subtle signs of lameness or neurological deficits because the inner limbs receive more of the weight-bearing forces than the outer limbs. treated in a similar way. Lateral and medial treatment of the stifle and elbow. Treatment of the shoulder. limbs like in rehabilitation of joint lesions.